Hi, Phyllis.
All right. Sorry for the delay in getting in. I need to find Dr. Ison.
Phyllis, are you recording this?
If you don't mind, we would like to record this so that we can send it out certainly to everybody.
That'd be great.
Yeah.
I have to leave early and I didn't want to miss a word. So.
Okay, let me text Dr. Ison to let him know that we're in. I don't know what happened here, but if you'll hang in there with me for a few more moments, let me get this all organized. As you might imagine, this has been a nightmare. my worst, yes, okay. Let me send this to everybody. Wait, no, don't have this email address. I want to reply to all. Okay. Okay. All right. Let me see where we're going. Yeah. Full screen. And how many? 28 people enter the waiting room view. Let me let everybody in. It all. Come on in, everybody. And
Hi, Stella.
hi. Okay, Dr. Ison, there you are.
Perfect.
All right, yay. I absolutely apologize for our technical difficulties. Had trouble with the password, and now I think there were 90 people signed up. So far, 64 of you. And we are, if you don't mind, we are recording this session. And I'm going to get started right now. And welcome all of you to this presentation by Dr. Ison, Michael Ison from Northwestern University. Welcoming you on behalf of Skyline Village, Chicago. Also Ken Grumke from Pathlights, which was formerly PLOW's, Area Agency on Aging, or Council on Aging. Also Forward Chicago with Helene Weinberg, and Karen Kolbsluti from the city of Chicago. So welcome, Dr. Ison, professor of the divisions of infectious diseases surgery and organ transplantation. And it is just a joy to have you back here again. I think a lot of us are joyful that we've all had at least our first, if not our second vaccine shots. And when I think back to when we first started here, we were all waiting for the moment that vaccines would even be discovered for this pandemic. Anyway, I'm going to turn it over to you and not waste another moment. I'm thrilled to have you here and thrilled that all of you are on the line.
No problem. Well, thanks again, and thanks for all of you that persisted. I wonder if we should send a quick email out to people, just telling them that we were a little delayed, just so that they can join in if they were waiting and got frustrated. Technology, thank goodness for all the technology that we've had to connect us, but sometimes it really gives us some challenges. Well, I was reflecting, here are my disclosures, they haven't changed. Literally 1 year ago today, this may look very familiar, the Pathlight, which used to be called PLOW's Council on Aging, organized a meeting at the Moraine Valley Community College. It was the first time that I gave an update to people. And I think it's pretty amazing to think back. This is when we weren't sure what was going to happen. People didn't even think that it was going to be as big of a deal as it was. In fact, I remember saying that I expected schools to close, and they had media there, and people fixated on that. How could I possibly think the schools would be closing? let alone, my hypothesis that there might be other mitigation strategies. Never in our wildest dream did we think all of us would be stuck at home for weeks, starting at the middle to end of March, and that the infection would cause so many incredible cases and huge numbers of deaths. So I thought I would just give a brief update on where we are. Thankfully, we're in a much better place than the last time I updated this group. Spend a fair amount of time talking about vaccines, focusing on the vaccines that are currently available, what data we have on safety, and we actually have a fair amount of data now, and briefly talk about access issues. I'll then finish briefly talking about the variants that everyone's heard about and that we are concerned about, just so that we can understand what they mean and where things are going. So I always like to start globally and look at where things are. I think it's important for us to recognize, if you look at how wide the bars are for a number of cases now, even though we think the numbers are going very well, it's still there are far more cases than we had globally during the summer or even during the first wave of the pandemic. And so this definitely isn't over. There's been 116 million cases globally, with 2.5 million deaths globally. Here in the United States, the last time I talked to this group, we were bright red. We were the epicenter. We had case numbers that were through the roof. Thankfully, we're at a situation where we're rapidly approaching what may be the lowest positivity rate of testing that we've seen during the entire pandemic. In the backdrop, there's fewer people getting tested. We don't really understand exactly why that is. Maybe people feel that they don't need to be tested. It's also partly a reflection of the low rates of disease in the community. In the United States, we've done still relatively poorly, with just shy of 30 million cases, representing nearly 21% of global cases, and 525,000 deaths, again, just shy of 20% of the deaths around the world. I think it's also helpful to look at the curves of our cases, deaths, and hospitalizations. While we're doing much, much better than we were before, if you look at where we are in terms of cases across the country, we're about where we were with the pandemic in the middle of the summer. Thankfully for us, that didn't amount to very many cases, but there are areas of the country that there were significant numbers of ongoing new cases. Our rate of deaths is still higher than the second peak during the summer, and so there's still thousands of people dying every single day. And the number of hospitalizations, while declining, again, is still at about the level where it was at the peak during the first two waves of COVID-19. We've been waiting for the vaccines, which were developed in really record time. And as Phyllis pointed out, hopefully all of you have gotten at least the first dose, and if not, have gotten the appointments to do so. We have 3 vaccines that are authorized in the United States. 2 utilize mRNA technology, in which just the gene that produces the spike protein is cleaved or cut out of the virus and put into a lipid or fat glob. This is then injected with 2 doses, 21 days apart for Pfizer, 28 days apart for Moderna. This lipid particle introduces the RNA into the cell. It can't get into the nucleus, and so it can't change the cell in any way. It then codes for the spike protein, which is produced on the surface of the cell, and that results in both humoral and cellular responses. We've seen great data from the trials that have been done. This is the Pfizer vaccine. where you can see the blue line are the patients that got placebo, red line, those patients that got the vaccine. And at about day 10 to 12, there was a divergence with a relatively flat line moving forward, suggesting this 95% protective efficacy, with the efficacy being very similar in the older adult population as the younger population. Side effects, some are very common injection site reactions. Most people report that the pain is worse with the first vaccine than with the second, with more of the kind of milder side effects like fever, fatigue, and muscle aches and pains and headaches, more commonly with the second vaccine. With the Moderna vaccine, again, we see a very similar picture where there's separation of the curves at around day 12 to 14, with again a 95% protective efficacy if you compare the gray line of the placebo with the blue line for the vaccinated patients. Again, similar incidence and similar types of side effects in these patients. The Janssen or Johnson & Johnson vaccine is slightly different from the other two vaccines. One, it's a single injection, so you only get one shot. Again, what they've done is they've cut the spike protein gene out from the virus and put it into the genetic material of an adenovirus, a virus that can affect humans. They've replaced the part of the virus that allows the virus to replicate, the polymerase, with this spike protein. So the virus can't actually replicate. And it's just, the virus is just being used to get the DNA within the cell. That DNA is injected into the nucleus where it's translated into mRNA, where it then goes into the cytoplasm or the guts of the cell to produce the spike proteins. And it's basically the same process in the end for producing immunity. Looking at the data, you see a separation right around day 16, so slightly a little bit later than the others two, but really at that 2-week mark, where the patients with the blue are the vaccinated population and the placebo are the red. And you can see that the separation is not quite as divergent as the mRNA vaccines. And this is where we get our 75 or so % protective efficacy with the Janssen vaccine. In terms of side effects, this I thought was a good way of comparing the different side effects. That slightly lower response is associated with a slightly lower incidence of side effects. About half of patients, 60% of patients have tenderness and pain at the injection site. And then similar but slightly lower incidence of the things like muscle aches, fatigue, and headache. So then looking at all of these vaccines that are authorized in the United States, the first three, Pfizer, Moderna, Johnson & Johnson, and then the two that will be coming along in the near future, the AstraZeneca and Novavax, we can look at their relative efficacy. The mRNA vaccines require 2 doses, the Johnson & Johnson or Janssen vaccine, single dose. Vaccine efficacy about 95% for the mRNA vaccines, vaccine efficacy around 72% in the US data for the Johnson & Johnson vaccines. Just so for people that are interested, these are the absolute number of breakthrough infections in the overall population.
Sure.
Now, the one thing that I always focus on is, while none of us want to get sick, we definitely don't want to get hospitalized or die. And all of these vaccines, despite this slight difference in vaccine efficacy in preventing clinical disease, are 100% effective in preventing hospitalizations and deaths. And so this is why it really doesn't matter which vaccine you get. The thing we don't want is people to get hospitalized or die. And that is equally protective for all of the vaccines, including the 3 that are authorized and the 2 that are going to likely follow on. Now, when people see these vaccines and see how quickly they were developed. It may make them nervous about their safety. The CDC and other branches of the US government have a number of different approaches to collecting data on the safety. And at this point, we have nearly 60 million individuals that have gotten at least one dose. And so we're starting to get a very robust real world experience in terms of safety. I'm going to show you data from two of these programs. The VSafe program, which everyone can participate in. You basically fill out a request on your phone after you get the vaccine. This then sends you text to fill out information. The second is the vaccine safety DataLink. Here, this is a much more prospective data set that includes several large health organizations, including all Kaiser entities around the United States, as well as other large organizations, including the Marshfield Clinic here in the Midwest. This looks at all of the data. These all patients get their data within these healthcare systems, so really does detect any signal, including more severe effects. From the VSafe data, we know that there have been about 28 million doses of the Pfizer vaccine given, 26 million doses of the Moderna vaccine, and there's about 1.7 million people who got the Pfizer vaccine that are participating in VSafe, and 2 million that got the Moderna. This includes a sizable portion of patients that were pregnant when they got the vaccine, 16,000 for Pfizer, 14,000 for Moderna. And what we can say from this is that the side effect profile is exactly what we saw in the studies. About 70% of people are having, 70 to 80% of people are having injection site reactions. That's more common with the second dose. There are significant incidents of fatigue, headache, and myalgia, particularly with the second dose. There wasn't as much data when this was presented publicly on the second dose of Moderna, so they only are showing the first dose here. The second bit of data is looking at more severe and less frequent events. These are things like anaphylaxis, Bell's palsy, autoimmune conditions, myocarditis, and this is drawing its data from these large healthcare structures. And the advantage of that is they can say in the year prior to COVID-19 vaccine, what was the incidence of these events, and how does that compare with the incidence of these events with the vaccine? So for example, I'm going to show you that there have been 23 cases of MI or heart attack after getting the vaccine within the first 4 weeks after the vaccine. That is comparable in this same type of population to 26 events in patients that weren't vaccinated. So these heart attacks likely would have happened whether the patient got the vaccine or not, and so there isn't a safety signal. And in fact, if you look at every single other thing that they've identified, strokes, Guillain-Barré syndrome, Bell's palsy, the incidence is not increased in these vaccine patients. And there's nearly 20 million people where this data is being collected on. So this is a huge population of patients where the data is being collected very carefully. There's also been a lot of attention on anaphylaxis or severe allergic reactions. This has been looked at very carefully by CDC and others. And as you can see, the majority of these reactions occur very soon after the vaccine is given, generally within 15 to 30 minutes. And this is why patients that where there's a concern, they are monitored very closely. And again, since anaphylaxis almost universally occurred by 15 minutes, the monitoring that is being done it should be well enough to capture these. It's important to recognize not a single case of anaphylaxis that's been reported in the United States. has required hospitalization, and nor has it resulted in death. All of these patients were treated oftentimes in the emergency room, monitored for a period of time, and discharged home. So while this is something concerning, this close monitoring is very successful in preventing severe outcomes. In fact, the current evidence suggests that there are 11 anaphylactic reactions per million doses, which is exactly the same as we see with the flu vaccine. So there's no increased risk of things like anaphylaxis with this vaccine. This has led the CDC to update their guidance, and really anyone with any allergies can receive the vaccine with close monitoring, with the exception of those individuals that have an immediate or severe reaction, anaphylaxis, due to one of the components of the vaccine. And that's either an mRNA vaccine that they may have received in the past. There are no licensed mRNA vaccines, so unless you were in a study, you haven't received one of these, or have an allergic reaction to PEG, polyethylene glycol, or polysorbitate. Again, these are in things that we eat and drink and put on our skin every day, so it's very unlikely that people have these reactions. If they do, then they should tell their provider, and they would be contraindicated for vaccination. It's currently estimated that less than 300 people in the United States have a contraindication to getting the vaccine because of this allergy profile. Now, I saw this graphic in a post from the Seattle Times, and I think it probably reflects what a lot of you have been struggling with. I know my parents took nearly a month to find the appointment to get their vaccine. There's, we're at a point where until very recently, people under 65, irrespective of their risk factors, weren't able to get the vaccine. You had all these little challenges. Could you get on? Was the system crashing? Was there someone to talk to if you could get in? But as we've expanded availability, there's a greater opportunity to get vaccinated. The best resource that I've been able to find is this Impact website. You can go to impact4hc.com. You can Google Impact COVID vaccine. The web address is insanely long, so I'll post it after the talk into the chat. But it really gives you information with links to how to register at the United Center, how to go to the Cook County website to get information about those sites. What the rules are for the different counties and city health departments in the greater Chicagoland area, links to the various pharmacy groups that are giving vaccines, and then links to a number of different organizations to really in one place be able to help you navigate where to get this information. And then ZocDoc is something I'll talk about on the next slide. With the opening of the United Center, this really is a huge advance. This is our highest throughput vaccine center, and there are going to be several more opening in the Chicagoland area in the near future. You can call in to register, and they have multiple languages that they're able to communicate with you. The reality is the availability online is the same availability as the phone person will have. So if you're frustrated because you can't find a vaccine online, calling them is not going to get you any special access. It's the exact same utility. So, and I just say that because if everyone's checking online and then calling, it just makes it harder for those people that don't have internet access and need to use the phone to contact the patients. The ZocDoc app I've gone through, it's very easy. You put your state and then find availability. You answer a couple of questions about your age, and what kind of underlying medical conditions. If you're eligible, it shows you the availability at a number of sites and allows you to register. If you have those underlying medical conditions that are now eligible for vaccination at the United Center, you click yes, and then it will allow you to move forward and make the appointment. Now, while we've done relatively well here in Chicago, we really have let some of our most underserved communities behind. So this is a very useful set of figures that a researcher at the University of Chicago puts out about once a week On the left-hand side with these kind of fall colors, the browns and oranges, this is the mortality due to COVID-19. The brighter red or dark red are the areas that have the highest rates of mortality due to COVID-19. These tend to come from areas that are have a higher proportion of poverty, African Americans, and Hispanic patients. You can see areas, for example, the area downtown where I live, very few deaths in these areas. And yet when you compare this on the right-hand side with the areas that have the highest vaccine rate, it's the complete inverse. So the area here in the bright purple downtown that had the lowest rate of mortality in the entire city represents the majority of the vaccinated epicenter. So you have about 15% of people vaccinated downtown. And then if you look at some of these areas that were heavily impacted by COVID-19, they have 0 to 2% in many of these areas. And this is an area where I think we need to do better. Part of the goal of the United Center and the use of multilingual telephone lines is to really help these individuals gain access. There's a lot of work that's going on with organizations to get the vaccine out to these sites. But again, this is going to play out around the country. And again, this is part of the reason why it's really important, while frustrating, to not jump ahead of the line, because then that may be taking vaccine from some of these people that are struggling and don't have as easy access to get vaccine. The issue of vaccine uptake nationally is also highly variable. This is a map. Darker green has a higher rate of vaccination of patients that have gotten at least one dose. We're doing okay. We're probably in the 18% range here in Illinois, but you see a lot of states, Texas, for example, very low rates of vaccination. A lot of the states, surprisingly, that are the ones opening their doors wide open, are happy to put people at risk, but are not doing the right things to get their individuals vaccinated. Those similar figures are seen if you look at patients that have gotten 2 doses. These kind of rural states like Montana, Wyoming, South Dakota, and North Dakota have done a great job in getting 10% of their population vaccine. Illinois, not doing quite as well. And this is data as of yesterday. So somewhere around 8.5%. So we're making progress, but not where we would like to be. And then we have to recognize, while things are rough here in the United States, around the world, they're even harsher. The UK is probably a little bit ahead of us in the United States. The EU, the countries of Europe, slightly behind the United States. And then you look at huge parts of the world. I have colleagues in Colombia, for example. They started vaccinating their first healthcare workers at the end of February. And so really and you can see large swaths of Africa, parts of the Middle East, haven't even started vaccinating. We were hoping to go to Egypt on a trip that we had postponed. They vaccinated 1,300 patients and healthcare workers as of yesterday. So really, if you're thinking about travel, part of the reason why I'm bringing this out is most of the world is far behind where we are. And so I think global travel is going to be markedly challenged as we move forward. Now, despite all of these challenges, we got some very clear messaging from CDC yesterday, which I think is going to help us think through how we can hopefully start getting back to a more normal life. The CDC came out with guidance for people that have completed their vaccine, and this only applies to people that are 2 weeks or greater after all doses of their vaccine. So the second dose, 2 weeks after the second dose of Moderna or Pfizer, or 2 weeks after the first dose of the Janssen, Johnson & Johnson. It only applies in areas outside of healthcare, so nursing homes, long-term care facilities, hospitals. These policies do not apply. So if you want to visit people in the nursing home or long-term care facility, it's still recommended that you keep the mask on and maintain social distancing. But if you have a small group of friends, 4 friends, let's say, all of whom have been fully vaccinated for at least 2 weeks, you can get together without a mask, without having to be diligent about physical distancing, and have a meal, play cards, do the things that you would have liked to do. You shouldn't have a group of 20. Needs to be small. So a very small group, less than probably 6 to 8 people is really optimal. You can visit with unvaccinated people. So you can go visit your grandkids with your children and their spouses, as long as there's no one that's at high risk for severe COVID in the household. So those people will be getting vaccinated shortly, but if, let's say, your son or daughter or their spouse has cancer, even though you're well vaccinated, you should not go visit them because of the small risk that the virus could be brought into the home. And then you don't need to quarantine or get tested if you have a known exposure to someone with COVID-19, as long as you remain asymptomatic. So these are all things that I think are starting to move us in the right direction based on science that shows that these vaccines are very potent in preventing infections. Now, there are some caveats to this, and I know that there were some questions about this. As people know, I take care of a lot of transplant patients. And what we're starting to see evidence come out is those patients that are heavily immunosuppressed, stem cell transplant patients, solid organ transplant patients, patients that are getting active chemotherapy, their response to the vaccine is much lower than otherwise healthy patients. And so they should still maintain masking, social distancing, and protecting themselves, because they probably don't have that 75 to 95% protection from the vaccine. It's probably a lot lower than that. We'll get some data that comes out in the near future to really guide our thought process with this. But again, I think if your immune system is strongly weakened, you still need to be very cautious. Outside of these small group settings with people that are all vaccinated, or very small group gatherings with a single household. So this isn't bring all your siblings together over to your house. One sibling and their family can come over at a time. Outside of that, you still need to do what we've been doing now. Wear your mask, wash your hands, and maintain that social distancing. And I think the critical thing is non-essential travel, and traveling to visit family is part of that non-essential travel, unfortunately, is still not considered safe. And part of the reason for that is what we're going to be talking about next. There are a number of, there's been a lot of discussion about variants. The UK variant is this first one that I'll show you. There's a number of mutations that have occurred within this virus, several in the spike protein, which is what we're making our antibodies to. Thankfully for this, only one of those mutations is in this yellow circle, which is what binds to the receptor on the cell. And so this transmits more easily, but appears to be pretty well protected by the vaccines that are out there. Why is this a concern? Because there are parts of the country, Florida, for example, 10 to 20% of the virus that's circulating in Florida is this variant. And again, we know that the vaccine protects pretty well, but is not 100% effective against this variant. And so traveling to areas, mostly the South, that have high rates of these disease, you potentially could be infected. And worse, you could bring the infection back and spark an outbreak here in the Chicagoland area. So this is why, until we get more people vaccinated, non-essential travel is a bit of a challenge. The South African variant, which is a bit more concerning. We've had at least one case here in the Chicagoland area identified, has 5 mutations within this yellow area. This is where the virus binds to the spike, or to the cell. And these 5 mutations, will result in reduction in protection from the vaccine. And I'll show you some data on that in a second. The last is the Brazilian strain, which you probably saw the group here at Northwestern identified the first case here in the Chicagoland area on Friday. This likewise has several mutations within this site that is important for the antibodies to protect us against, and therefore we would expect to see reduced vaccine efficacy with this variant. And in fact, if you look at the data that we have, really, there's only a slight reduction in efficacy with the UK variant. Instead of being 95% effective, it's about 86% effective. So you lose about 10% of the protective efficacy with the UK variant. You lose a lot more with the South African strain. So from 75 to about 57% with the Johnson & Johnson vaccine. So again, you're losing about 20% of the vaccine efficacy with the South African strain. The good news is here in the Chicagoland area, we haven't seen a significant increase in the UK variant or the South African variant, although we know that it is here in the community. But this is, again, why it's still important that we protect ourselves when we're in the general community, recognizing that only about 8.5% of the Illinois population has been fully vaccinated against COVID-19. So with that, I'm happy to open it up for questions. And hopefully this was helpful.
Well, yes, very, very much so. Thank you so much. This was just wonderful. We had sent you several questions that came out in before.
Yep.
Somebody wrote in that I had COVID in December 2020. I was sleeping a lot and fatigued as well. Now I'm experiencing nightmares and bad dreams. Both are unusual. Could this be COVID related?
Yeah. So one of the things that we have recognized is what's called the long haul syndrome or post-COVID disease, this affects patients in a very heterogeneous way, meaning that patients that weren't in the hospital that had milder disease are actually more likely to experience some of these, and neurologic problems, general fatigue, nightmares, sometimes depression in these individuals can persist for a relatively long time after the infection. There are a number of other things. People have developed insulin resistance, so that pre-diabetes in some patients. People have developed joint pains, difficulty breathing, heart pain, and other complications. There are a number of different groups. Northwestern has one. Some of the other hospitals have them that have post-COVID clinics that have experts that can help you with some of these problems. So I'd recommend reaching out to your doctor and getting referred into one of those sites.
I was going to actually ask from a research point of view, is this being tracked?
Yeah, so it's there are several groups in the city. Our group has a very large post-COVID research program going at Northwestern. The NIH just issued its intent to have $1.1 billion of research plunked into this specific issue. So there's going to be a lot of interest and focus on this. One of the challenges is that most of the data that we have is from patients complaining about this. There haven't been many studies where basically everyone that had COVID was asked, do they have these? And we suspect that we'll be doing that soon here at Northwestern. But we suspect when we start doing that, we'll find that it's much more prevalent than some of the earlier studies had shown. Great,
thank you. I think you've asked the next question, and that's about being safe to eat in restaurants with others who've had their shots. So I'm going to pass that one up.
Well, I think it is important. It is important to say you can have a meal together in your own home, but at a restaurant, you've got a lot of other unvaccinated individuals. So, my advice is, for now, let's wait and see when CDC updates the guidance. My bet is when we get more of the population vaccinated in the next month or two, they'll recommend broader opportunities to get together. Getting together in your home, perfectly fine.
Great. Vaccination cards, and I'm not sure you can tell us, but those of us who have been vaccinated at Northwestern only are told to go to My Chart to pull down the immunization records. Other friends of ours have gone other places and have gotten cards, actual cards that look fairly official. Do you know anything about the need for or how to get these this official?
Yeah. So if you look very carefully, the CDC guidance is very clear. All you need to document that you've gotten the vaccine is either the card or the documentation of the vaccine, and what you'll get if you get the immunization record from Northwestern, it will be compliant with what's needed internationally or for CDC. We did hear from a lot of people that they were frustrated because they weren't getting the CDC card. So that's something that you can now request, and it will be generated for you to get the CDC card. Part of the concern, though, that I will say, and part of the reason why we didn't issue them early on, is there were people that were forging them and not getting vaccinated, but writing their own names in and copying lot numbers and things like that from things that they were seeing people posting online. And so again, that was part of the driver for not issuing the cards initially.
Great. Well, thank you. Thanks for that answer. How effective are the vaccines? And I think you did address this against the new variants.
Yeah, so the UK variant, which is the one that will likely be the biggest problem, is still very good, but not as great as against the wild type. So again, 95% protective efficacy for the Moderna and Pfizer for what the viruses that are out there now, about 85% vaccine efficacy against the UK variant, probably lower against some of the others. They probably still will protect you against severe disease. So if you were to get infected with one of these variant viruses, the cellular responses, not the humoral immunity, should protect you from needing to be in the hospital or dying.
Okay, this is a very practical one. 4 weeks after my second vaccine shot, is it okay to go to the beauty parlor to get my hair cut and colored?
Yeah, I would say yes, wear your mask while you're there, because again, you don't know if the stylist has been vaccinated, if the other people that are in the salon have been vaccinated. So I think it's, the nice thing is these vaccines have markedly decreased the risk, but they still don't give us the take off your mask for free card yet.
With the variant, another question, with the variety of what is it? After the vaccine, after you've gotten the shot, some people have had reactions, some people have not had reactions. Is the vaccine effective if you didn't have a reaction?
Yeah. So what we know is that only about 60% or so of people will have any kind of reaction other than a sore arm, and still 95% are protected. So the best thing I can say is if you had a reaction, you had a good response. If you didn't have a reaction, you were lucky.
That's great. I think all of us are happy to hear that. Ibuprofen, does taking ibuprofen interfere with the production of antibodies?
So this has been the worst myth that's been circulated by even some of the healthcare professionals. There has never been a study in adults that has shown any reduction in antibody production with the use of NSAIDs of any kind. Ibuprofen, aspirin, whatever. There was a very small study in children from 20 years ago that showed that patients that got aspirin had a 2% lower response to their vaccine by antibody response. In the end, I wouldn't worry about it at all. I would take the Tylenol or Advil for your pain. If you're really worried about it, Tylenol doesn't reduce inflammation, so wouldn't affect the immune responses.
Great. Antibody tests. Is it, the question actually was phrased, is it worth it to have the antibody test? My internist doesn't believe in it. Is there a place at Northwestern to get the test?
Yeah, so I can come and tell you 100% no one should be getting the antibody test. No one is recommending it from a professional society. It is not something that we recommend at all at Northwestern. And the reason for this is there are literally hundreds of antibody tests, almost all of which that are commercially available do not tell you whether or not you're protected against COVID-19. They just tell you that you have antibodies. The problem with that is you need a very specific antibody to protect you from COVID-19 called neutralizing antibodies. Most of the vaccines don't look for that. Half the assays look for the nucleoprotein, which you won't develop antibodies to because you have antibodies to spike, not the nucleoprotein. So you're going to be misled by those results. Additionally, even if it shows positive, they don't tell you titer or how much antibody is there. And what we know is that you need a certain level of antibody to be protective. So it is going to 100% mislead you. There's no reason to get it. The patients that participated in the study provided us the data that we need. 95% protective efficacy, 95% are producing antibodies, and the benefit is nearly identical in patients over and under 65 years of age.
Another question. What is the efficacy of the Pfizer or Moderna vaccine if you're on immune suppressant medications?
Yeah, so we don't have the exact answer for that. We've gotten some preliminary data that shows that you have reduced protection from an antibody production standpoint. Whether or not that reduces your likelihood of developing severe disease or not is something that we need studies. And this is why for our transplant patients, we're still recommending being a little bit cautious. And even if you've been vaccinated, this isn't the time to go travel to visit your family in another state. And we still are recommending using masks and avoiding large gatherings, even with other vaccinated people.
Thank you. There were several questions about if I get Moderna, or several questions that are similar. If I get Moderna for one, could I get Pfizer for shot number two? Another question had to do if I have Pfizer and I can't get the second shot for 4 weeks, does that matter?
Yeah, so we're not, yeah, that's an easy one. CDC and physicians are not recommending mixing vaccine types. So if you get Moderna, you should get the second dose of Moderna. If you get Pfizer, the second dose should be Pfizer. If you're going back to the same vaccine site, they should have a supply of the appropriate vaccine. If you have to extend the amount of time because the second appointment is missed or something comes up and you have to push the second dose back, that's perfectly fine. It's not going to affect the vaccine efficacy.
There was a question about, is there a difference in the effectiveness of the vaccines based on age and health conditions and yeah. Are they finding differences? Because I know that they were tested on a wide range of ages. Is there any difference based on age?
Yeah. So what we're finding is it's a tiny difference in terms of vaccine efficacy. It's about a 1% difference for the mRNA vaccines and about a 4% difference for the Johnson & Johnson vaccine. The one thing that isn't different is risk of hospitalization and death. That's 0 for patients, whether they're 30 or 80. And so again, this is everyone's fixated on not getting infected. In the end, I want to be alive and I don't want to be in the hospital. That's what matters to me. And all of the vaccines are 100% effective against that in all age groups.
Okay, here's one. My 86-year-old mother refuses to get the vaccine. I'm 61 and have not yet received any vaccine. Wondering about my risks before I get the vaccine and after.
Yeah, your risks before the vaccine are the same as they have been for the last year. So you just really need to wear a mask, avoid large crowds, wash your hands very diligently. And after the vaccine, you have to wait until you get both doses, and 2 weeks after that, then the risk drops markedly. Risk is for hospitalization or death is 0. The risk of getting infected is about 5%.
Right. This one has to do with the 4 weeks and 3 and 4 weeks. My daughter received the Pfizer vaccine from a pharmacy, was scheduled for a second shot in 4 weeks, not 3. Is that okay?
Perfectly fine. It really doesn't matter. The data that's coming out of groups around the country that are intentionally deferring vaccine, no difference in vaccine efficacy.
Okay, here's another one. My understanding is that it's hard to compare reported efficacy of Johnson & Johnson to the mRNA vaccines because Johnson & Johnson is later in time and in presence of more of the new variants. Could you comment?
Not really. So, again, breaking it down to the key finding of hospitalization and death, 100% just like the others. So they're equivalent from that. The other issue is the Johnson & Johnson did do studies in areas like South Africa where they did have variants and were able to demonstrate the vaccine efficacy. The majority of the data from the vaccines was derived from patients while we were in the middle of the second wave here. About 75% of the cases were while there were high numbers. And again, it's all not compared to a historic control, but it's a concurrently enrolled control. So as cases go down, there's one placebo for every vaccinated patient. And so, they're well matched even over time.
Right. Somebody said, or Dolores Simon said, in the last slide, it mentioned something about allergies that are monitored. She asks why, and is it any different than anyone for the normal 15 minutes?
The reason for that is people that have had a history of allergic reaction to other injectable medications are monitored for 30 minutes. And that's just, again, to be cautious to capture any of those later allergic reactions that may occur. So far, really, there hasn't been much yield for that extension to 30 minutes. And I suspect it will probably be kind of gotten rid of at some point in the future.
There's a question here from Cynthia about how dangerous is it if the vaccines are mistakenly mixed. Are you aware of that happening?
I'm sure that there have been cases. The problem is although they're very similar, the antigens are slightly different, and so you may not get the same degree of boosting, and there have been no studies yet to look at that. And so not a single doctor that I'm aware of is recommending mixing of those.
The question actually is it dangerous?
It's not dangerous at all. It's just you may get no boosting from the second dose.
Well, that's good to know. What about public transportation if we're fully vaccinated?
Again, I think that the premise of the guidance from CDC, small groups in a controlled setting, you can be without a mask. Again, outside of that, remember that 92% of people aren't vaccinated and are potentially spreading infection. So you still need to wear a mask, hand hygiene, and social distancing. Again, if you were to acquire COVID-19, your risk is much lower. And so, it's safer today once you've been vaccinated than it was a month or two ago before you were vaccinated.
And another question, how long, or do you know how long the brain fog lasts?
Yeah, it's been described to last a relatively long time in some people. It's different for each individual.
Yeah. I was told by the doctor to take photos of the vaccine experience, your arm after the injection and days thereafter for additional proof that you had the vaccine.
Not needed.
I love that question though. How many of us did not take pictures of the vaccine?
Right, exactly. And
mostly to send out to family and friends.
Yeah, right. Hopefully you took the selfie, and I would encourage people just to encourage your family and friends, because still about a quarter of people don't want the vaccine, which is frustrating. Maybe one more question, because I'm going to have to zip off to another call.
Yeah, and we appreciate this time. Okay, the final question. I have asthma. I'm 61. It seems to no longer be something that moves me closer to the front of the line.
So patients with underlying health conditions that are under 65 can now register and get appointments at the United Center. In some counties outside of the Chicagoland area, they would be able to get the vaccine as well. And shortly, it'll be more widely available here in the Chicagoland area. The other thing I was going to say about where to get your vaccine and whatnot, I'm going to be very blunt. Don't count on your regular doctors. Most hospitals and healthcare systems are getting very limited supplies of vaccine. And so really, I think the key is look at all your resources, go to the United Center, go to the Walgreens websites, go to ZocDoc, look at every option to get your vaccine. There are vaccines at the healthcare setting, they're just very limited in availability.
Dr. Ison, we cannot thank you enough for coming to us again for this very, very wonderful update. Thank you, thank you, thank you.
No problem.
And yes, and we'll look forward to having you back again
Sounds good.
when we can and maybe celebrate, maybe have a party together. Wouldn't that be fun? We'll all come to
That'd be great.
Northwestern.
I love it. I love it.
Wonderful. And thank everybody for your
Thank you.
patience for our technical difficulties. We apologize for that. It was great to see everybody. Thank you all. Have a great day. Hopefully you can enjoy the sunshine.
Bye.
Bye.
In the next few days, we'll make a request to Northwestern.
Mhm.